Bismillahirrahmanirrahim. Assalamu alaikum. Welcome back to Insight Pharmacy Life. Today we will explore common eye disorders you might see at the pharmacy like dry eye, conjunctivitis, styes, chalazion and blepharitis. We will go through symptoms, OTC treatment options and non-drug measures, and of course I will point out when you should refer a patient to an eye specialist. Here are some learning objectives. By the end of this video, you will be able to identify common eye conditions, choose safe OTC products, recommend helpful self-care measures, and know the red flag symptoms that require medical attention. Dry eye syndrome. Dry eye is very common, especially in people who use screens for long hours, wear contact lenses, or are older. OTC products like artificial tears help add moisture. Look for carboxymethylcellulose or hypromellose on the label. For night use, ointments or drops with petrolatum and mineral oil work well, but they can blur vision temporarily. Non-drug tips include reducing screen time, blinking more often, and using a humidifier at home. Here are some brands of artificial tears and lubricants: Sustain eye drops, Hylo eye drops, Blink eye drops, Lubricane eye drops, I Love eye drops, High Tears eye drops, Tears Fort eye drops, Tears Cool eye drops, Of These eye drops, and Blink Fresh eye drops. You can easily get any of these products from any of the pharmacy. Next one is the bacterial conjunctivitis. This is often called pink eye. Symptoms include redness, sticky yellow or green discharge, and eyelids sticking together in the morning. Chloramphenicol drops or ointments are available OTC. Otherwise, lubricating drops can help wash out discharge while the body fights infection. Warm compresses can soften crust, and strict hand hygiene is important to prevent spread. This is included in the non-pharmacological treatment. Warm compresses, hand hygiene, avoid sharing towels or pillows. Refer to a doctor if there is vision loss, severe pain, or the patient wears contact lenses. Here are some brands of chloramphenicol eye drops: Chloroptic eye drops, Optachlor eye drops, Phenoptic eye drops, Methachlor eye drops, Dexachlor eye drops, and Prednicol eye drops. Next one is the viral conjunctivitis. Viral conjunctivitis is usually watery, gritty, and often linked to a cold or sore throat. OTC pharmacological treatment. There is no specific cure. Treatment is supportive. Artificial tears help with discomfort, and antihistamine plus decongestant eye drops can ease redness and itching. Non-pharmacological treatment includes cold compresses. Cold compresses can soothe the eyes, but remember this is very contagious, so patients should avoid touching their eyes and wash hands frequently. Refer if symptoms last more than 2 weeks or vision is affected. Decongestant eye drop brands includes Curine eye drops, Curol A eye drops, and Histazoline eye drops. So the next one is the allergic conjunctivitis. This type is itchy, watery, and often seasonal. OTC pharmacological treatments include OTC antihistamine drops like ketotifen, brand name Ketot, or olopatadine drops, brand names Olopat eye drops, Olublu eye drops, Zolopt eye drops. Antihistamine plus decongestant combination drops includes Curine eye drops, Curol A eye drops, Histazoline eye drops. These can also be helpful. Artificial tears can flush out allergens. Non-drug measures include avoiding triggers, wearing sunglasses outdoors, and using cold compresses to reduce itch and swallowing. So the next one is hordeolum. Hordeolum or stye is a painful lump at the eyelid margin caused by a bacterial infection. OTC lubricating drops can help comfort, and in some antibiotics ointments are available without prescription. The best treatment is best non-pharmacological treatment is warm compresses applied 3 to 4 times daily and gentle eyelid massage to encourage drainage. Advise patients not to squeeze the stye and refer if swelling spreads or it keeps coming back. So the next one is chalazion. A chalazion is a firm painless lump caused by a blocked oil gland in the eyelid. There is no specific OTC medicine, but lubricating eye drops can help with mild irritation. Non-pharmacological treatment include warm compresses and gentle massage can encourage drainage. Most resolve on their own within weeks, but if it persists for more than a month or interferes with vision, refer to an ophthalmologist. Next one is the blepharitis. Blepharitis is an inflammation of the eyelid margins, often causing crusting, irritation, and burning. OTC lubricating drops relieve dryness. Eyelid hygiene is key. Use special lid wipes or diluted baby shampoo on a clean cotton pad. Warm compresses help loosen crust. Avoid eye makeup during flare-ups. Patients with chronic or severe symptoms should be referred for further evaluation. Here are some red flag symptoms. Always advise urgent referral for severe eye pain, sudden vision loss, extreme light sensitivity, chemical injury, or eye trauma. Also, contact lens wearers with red eye should see a doctor immediately due to the risk of serious infections. This is it for today's Inside Pharmacy Live session on OTC products for common eye disorders. If you found this helpful, please like, share, and subscribe. Thank you very much.